Did you know that if you've had preeclampsia, your pregnancy may have revealed something that most women are never told? It can be an early warning sign for your long term heart health. Large studies following women for decades show that preeclampsia is associated with a higher risk of high blood pressure, heart disease, and stroke later in life. So the real question becomes, why does this happen and what should you do next? Hey there, Mama. I'm Dr. Jessica Poland. I'm an OBGYN and maternal fetal medicine physician with VitalFem MD. If you've had preeclampsia, I'm really glad that you're here because what happens after delivery is so important, almost as important, maybe more than what happened during your pregnancy. Today, we'll break down what preeclampsia actually is, what it means for your body long term, your future pregnancy risks, and the simple steps that you can take right now to protect your health. Let's get into it. So, what exactly is preeclampsia? Preeclampsia is a pregnancy specific complication involving high blood pressure and signs of organ stress, most often kidneys, liver, brain, or placenta. But the real origin starts much earlier. In early pregnancy, placenta cells called trophoblasts normally invade and remodel spiral arteries within your uterus. This transformation is critical and it's beautiful because it turns small, high resistance vessels into large, low resistance vessels that can deliver enough blood to help your baby and your placenta grow. When you have preeclampsia, that process is incomplete. That's why preeclampsia is not just blood pressure in pregnancy, it's actually a systemic vascular condition triggered by an abnormal placenta. So think of pregnancy like a stress test. And preeclampsia is one of the ways your body shows us where your cardiovascular system is vulnerable. Let's talk about the first year after delivery. Here's something that many women are actually never told. Delivery resolves the pregnancy, but does not always resolve the vascular changes immediately. Some women return to blood pressure control normally and very quickly. Others have persistent high blood pressure for weeks or even months postpartum. So, in the first year after delivery, this is what matters the most. If you had preeclampsia, monitor your blood pressure. Do not ignore symptoms like severe headache, vision changes, chest pain, or shortness of breath. And make sure you have scheduled follow up, not just with your OB, but with your primary care as well, because this is where long term prevention actually starts, not later, right now. Long term health risks. Here's what the research show. Large population studies following over 1 million women for up to 20 years have consistently found the same pattern. Women with a history of preeclampsia have approximately 2 to 3 times higher risk of developing chronic hypertension, about 2 times higher risk of heart disease, and also increased risk of stroke and heart failure. Now, this is really important. This does not mean these outcomes will for sure happen. It simply means that preeclampsia is an early marker of cardiovascular susceptibility. In many cases, these changes appear years or even decades before heart disease would otherwise have become clinically obvious. And that's actually really powerful because it gives us time to intervene, time to monitor, time to change your trajectory. That's why pregnancy history is now considered part of the lifetime cardiovascular assessment for women. Your pregnancy didn't just end, it gave us data. What you can do now. So, what actually helps? We focus on 3 core systems here at Vital Fem: blood vessels, metabolism, and inflammation, starting with nutrition, the number one thing that you can control. A Mediterranean style diet is strongly associated with better cardiovascular outcomes. You've heard me say it before here on the channel: vegetables, fruits, lean proteins, fish, beans, nuts, olive oil, and high fiber carbohydrates. The next is movement. You don't need intense workouts. A daily walk is enough to improve your insulin sensitivity, vascular health, and your blood pressure control. Consistency matters more than intensity. Third is sleep and stress. Chronic sleep deprivation increases inflammation and insulin resistance. Both of these can impact your blood pressure long term. Finally, mama, know your numbers. know your blood pressure, know your cholesterol, know your blood sugar. These are not later in life when I'm old labs anymore. These are postpartum and early intervention tools. Let's talk about future pregnancies. If you're planning another pregnancy, this is super exciting, and this is where preconception care actually becomes extremely important. A preconception evaluation allows us to review your prior pregnancies, assess your baseline blood pressure, and identify modifiable risk factors before you get pregnant. Many women ask the same question: will this happen to me again? The answer is there is for sure an increased risk, but it definitely varies. In general, earlier onset preeclampsia with severe disease has a higher recurrence risk. Later, mild disease has a lower recurrence risk. Many women do not have recurrence in future pregnancies. And even when the risk is elevated, we can certainly reduce it with early interventions, including low dose aspirin, 81 milligrams, starting by 12 weeks gestation, closer monitoring, and optimized health before conception. This is why your prior pregnancy history matters so much. It helps us plan your next pregnancy even better. Preeclampsia is not something that just happened during your pregnancy. It's information about your cardiovascular system. Information gives us power to monitor earlier, power to intervene sooner, and power to protect your long term health. Take care of yourself, mama. I'll see you in the next video.